Good afternoon, everyone. Thanks for joining us today, joining the National African American Tobacco Prevention Network as we host promising practices for tobacco prevention and control in African American communities. This will be a webinar and live panel discussion. The National African American Tobacco Prevention Network, or NAATPN, we are a national organization dedicated to facilitating the development and implementation of comprehensive and community competent tobacco control programs to benefit communities and people of African descent. NAATPN is one of 6 CDC-funded national networks that engages national and statewide partners by providing technical assistance in tobacco control and prevention activities. The purpose of this meeting today, we are going to discuss and review some outcomes impacting tobacco control and prevention in African American communities. We're going to talk about some promising practices and community competent initiatives that are currently taking place. We're going to look at opportunities for action that could impact African American communities. And we're going to begin a dialogue on how we prioritize these opportunities for action. One of the first opportunities, of course, is we have an opportunity to coordinate our efforts to ban menthol. These efforts right now have stalled. There's no doubt about it, and for fault of our own or for fault of the environment and things that have happened in the environment, efforts to ban menthol have stalled. And so the opportunity exists for us to coordinate these efforts together so that we can pick up that momentum again. Another opportunity, of course, is we talk about reducing tobacco in the African American community. We know that it also will then impact a reduction overall in tobacco consumption in the larger community. And so we have an opportunity to be a part of that reduction and making sure that that message stays out, that it's an overall thing. We really have an opportunity to educate African Americans about why tobacco use is a bad proposition. The opportunities exist, our local level efforts, things that Mr. Brown is doing at the local level that we appreciate, that he is out there actually standing up in front of his congregation, making sure that it's on church bulletins weekly, not just one time, but weekly, that they're making that message known that tobacco use is a bad proposition. A real opportunity that we have, and we are going to call on all of our researchers, all of our partners, anyone that we can think of, we need to increase scholarly peer-reviewed research on smoking in minority populations. We need to have data that we can go through. We need to have articles that we can call upon. I know that when we work with the Tobacco Prevention and Evaluation Program to even look at outcomes that have happened over the past 10 years, there weren't a lot of things in there that we could pull upon in terms of community initiatives. Does that mean they haven't been happening? Absolutely not. It just means that no one has done the research on them, no one has published them, and so therefore when you do a search on them, you can't find anything because it doesn't exist. And so that opportunity is, again, staring us in the face. We have to press our African American leadership organizations and our media, the HBCUs, the civic organizations. They need to join our fight. We know that a lot of them get industry funding. We know that that's an issue. We know that some of them rely upon it, but they have to be a part of our movement, and we have to get them to divest their interest in the tobacco industry. And we've got to promote measurable long-term impacts and outcomes. And so this can't just be what we're going to do the end of this fiscal year, but we've got to look beyond. And I'll tell you why, because we all know that the industry is looking beyond. They've already got their long-term plans, and so we need to develop ours.